Hello, my name is Umang Shah, and I shall be presenting an overview on the Canadian and European regulatory landscape. I currently head the regulatory CMC team for cell-based vaccines at Novartis, and we are responsible for leading, managing, and maintaining submissions of INDs, clinical trial applications, BLAs, as well as marketing authorization applications in various regions, including the U.S., Europe, and Canada. These two presentations shall provide you with a high-level overview of the essential areas of regulatory knowledge and understanding. You will learn about the regulatory framework and applicable legislation for new drugs as well as generic drugs. Topics covered include health authority organization, i.e. key branches and directorates, submission required for clinical trials and marketing authorization, approvals, GMPs, post-approval changes, import and export, patents, data protection, and exclusivity, among other relevant topics. While the slides are many and busy, it is not my intent to read through each slide. The details in the slides are for your understanding and future reference. However, I shall summarize each topic as we move from one slide to the next. Broadly, upon completion of this presentation, the participant shall be able to identify Canadian legislation and how it fits within the Canadian Health Authority framework, how drugs are classified in Canada. We shall also review the Health Canada organization and discuss various agency interactions locally as well as globally. We shall also review various types of pre-approval submissions as well as categorize post-approval changes and submissions. This will be followed by a brief overview of the IP requirements, including eligibility criteria in Canada. Towards the end of the presentation, we shall review various other activities, including pharmacovigilance, the pricing and reimbursement structure in Canada, as well as import and export requirements. Moving on to slide 3. We will now look at the history and organization of Health Canada. Canada is the world's second largest country in terms of land mass. Ottawa is the capital of Canada and is located in the province of Ontario. Canada has 10 provinces and 3 territories, each with its own capital city. Canada is a constitutional monarchy, a federal state, and a parliamentary democracy with 2 official languages, English and French. In the democratic system of government, the Governor-General governs through a cabinet led by the Prime Minister. The Queen of England is also Canada's Queen. In her capacity as Queen of Canada, she delegates her powers to a Canadian Governor-General. So while the Queen rules, she does not govern. Canada's constitution was initially a British statute, the British North America Act of 1867, and until 1982, major amendments required action by the British Parliament. Since 1982, when the Constitution was patriated, this founding statute has been known as the Constitution Act, spanning between 1867 through 1982. In the Constitution Act of 1867, health is not specifically mentioned and therefore not within the exclusive domain of the federal parliament or the provincial legislatures. The Constitutional Act of Canada sets out division of power between the federal and provincial governments. The Department of Canada's federal government responsible for health is called Health Canada. Health Canada has the authority to develop and enforce legislation such as the Food and Drugs Act, also known as the F&D Act. Health Canada regulates the safety and efficacy of drugs and medical devices under the authority of the Food and Drugs Act, which we shall discuss in subsequent slides. The key enabling acts and regulations include Food and Drugs Act, Patent Act, Food and Drug Regulations, Patented Medicines Regulations, and New Substances Notification Regulations. Canadians have a right of access to the laws and regulations that govern their daily lives. Due to its legislative content, the Canada Gazette, an official newspaper of the Government of Canada, is one of the vehicles that guarantees that right of access. The Canada Gazette consists of 3 parts. Part 1 contains public notices and proposed regulations from the government. Similar to the Federal Register is in the U.S., The Canada Gazette serves as a vehicle for engaging the general public in voicing any concerns about the proposed regulations published in Part 1. Canadians can actively contribute to the regulatory process by sending their comments or concerns on the subject under Constitution to the appropriate department or agency. The Canada Gazette, Part 2, contains all regulations that have been enacted. In the next slide, we shall further review the Canadian Food and Drugs Act.